Hello, and welcome to Group 3's presentation on the rationale for interprofessional collaboration in Canada. This presentation has been contributed to by Dustin, Lisa, Shannon, Batul, and Abby. The goals of this presentation is to first define interprofessional collaboration, or IPC for short. Next, we'll identify what we believe to be the rationale for IPC in Canada. As you can imagine, the rationale is multidimensional, so we have focused on what we believe has the most significant impact on quality patient care. Finally, we will tie it all together and offer suggestions on what we see as important next steps to further IPC in Canada. The World Health Organization defines IPC as multiple health workers from different professional backgrounds working together with patients, families, carers, and communities to deliver the highest quality of care. Our group believes IPC is now, more than ever, a crucial driving force towards high-quality care. Interprofessional collaboration is the foundation for quality care, and it has the greatest impact on the way in which the patient care is managed and transferred in Canada. Patients within Canada's healthcare system stand to benefit the most from interprofessional collaboration. The following slides will highlight the rationales for IPC in Canada. First and foremost, it is important to identify that IPC facilitates communication. Effective communication is crucial to optimal patient outcomes, and poor communication can lead to patient harm. High quality and safe care depends on the ability of healthcare providers to communicate well with patients and with other professionals. This is especially difficult when professionals exist in different care settings and wide geographical regions, and is particularly true for patients in remote or rural communities where travel is required to receive healthcare. To overcome this barrier to effective interprofessional communication, a common accessible patient record in collaborative care is required to enable communication between physicians and other healthcare professionals. To provide the safest and finest care, electronic health records, or EHRs for short, can be used as a logical tool in IPC to maximize the quality of healthcare. Plus, tracking and reporting in healthcare within IPC is easier through EHR. The next slide will briefly discuss EHRs as facilitators of IPC. Electronic records improves communication between healthcare professionals. For instance, it provides speedy access to patient information, enabling real-time communication about a patient when a physician responds to phone inquiries from other clinicians. Moreover, it improves interprofessional communication between professionals, as EMRs foster the feeling that the patient information is shared for teaching and management purposes. EHRs can store and retrieve the data, which means to improve the quality of patients' care. EHRs can consolidate patient information such as diagnosis, medications, and test results, which enables IPC to provide safer care services. EHRs aid in decision-making among IPCs. For instance, it prompts when tests are due or when a particular care does not meet guidelines. Tracking and follow-up can mark irregular test results and stored information about the patient's signs and symptoms. In addition to IPC improving communication between professionals, healthcare is made more efficient by interdisciplinary collaboration. When working on a team, healthcare professionals spend less time trying to diagnose complex issues affecting their patients, outsourcing difficult problems to team members that may be better qualified to address said issue. A faster diagnosis will mean work can begin on a solution sooner rather than later. This in turn means that the patient will receive the appropriate care sooner than if a single healthcare professional were to attempt to resolve the issue solo. Often, a patient can bring many complex issues to the table. These issues are usually broad in scope and can be a lot for a single professional to handle. When on a team, the issues of the patient can be delegated by the most qualified team members. This support system can make it much easier for healthcare professionals to manage their patients. Knowing issues that fall beyond their scope of practice are in good hands. A rudimentary metaphor for this effect can be seen in how a single person cannot lift a car, but a team of 10 people can easily get all four wheels off the ground. While working on a team, other healthcare professionals can help expose individual team members to other occupations with different scopes of practice. Professionals accumulate knowledge from witnessing others on a team approach, diagnose, and resolve issues in ways that they are different from their own. This broadens the understanding of each individual professional, allowing them to recognize diverse patient ailments and point them in the right direction more quickly. There can be issues that negatively affect the efficiency of healthcare when professionals work on a team. In collaborative efforts, professional roles need to be clearly defined and respected. Every team member needs to know what the other team member's strengths are and needs to understand the importance of each role. Failure to understand each team member's role can result in individual team members taking on more work than others, while ignoring the usefulness of the other professionals at their disposal. This often results in the lone wolf effect. This is where a single team member believes their expertise are more valuable and encompassing than one or more other professionals on the team. As a result, they will slow the effectiveness of their team by taking on more work than they should and ignoring those more qualified on the team. Another mistake that can be made when collaborating between professions is overlooking the importance of an organizational process. Simply assigning an issue to individual members of a team is not enough. There needs to be communicated resolution and acknowledged accountability for each issue addressed. The entire team needs to know what is going on and be on the same page in terms of who's dealing with which problem. Failure to establish an organizational system can result in more than one professional addressing the same issue, a problem known as redundancy. Due to many variables that exist throughout the care of a patient, the development of a successful interprofessional module is essential yet challenging at the same time. An unsuccessful collaboration could result in less than desirable care for the patient, delayed results, and worst of all, an incorrect diagnosis. In an effort to ensure that these mishaps do not happen and are kept to the minimum, good communication is essential within the interprofessional team. Good communication among all team members can help alleviate redundancies and allow the patient to have a better experience while under the care of the hospital. Some examples of redundant care include the unnecessary questioning of patient history repeatedly, unwanted disruption during a patient's stay or care at the hospital, as well as repetition and reordering of protocol tests during the same visit that can cause discomfort and also prolong the patient's wait time for results. Unnecessary wait times for result is not only wasting time for the patient, but also for laboratory personnel, nurses, doctors, and other members of the healthcare team. The patient's stay at the hospital is unnecessarily prolonged, and which in turn decreases the amount of available bed space that could otherwise be directed towards other patients who are more in need. Redundant care also puts a burden on the hospital's budget. Running unnecessarily tests because of the lack of effective communication, as well as the hoarding of bed space due to extended turnaround times for results, can result in unwanted strain on both the laboratory's resources and the hospital's reputation. It is very important to remember and be aware that the patients are customers to the service the hospital provides. They should be treated with respect and compassion during their stay so that they feel included in any decision-making processes. This can help empower the patient to stay positive and feel confident in their healthcare team that they are getting the best care possible during their time of need. It is vital to highlight the difference between proper attention and duplicated or redundant attention. Proper attention could be described as providing a patient with necessary care during their time in the hospital, such as running the appropriate tests in a timely manner, and providing the patient with information to clarify any questions they might have regarding their care. Duplicate or redundant attention could stem from a failure to understand the processes and principles for working together. When one is unsure of their role or duties in the interprofessional team, unneeded attention is given to the wrong areas. Role clarification can help with this, and this concept will be elaborated on later in the presentation. It is important to provide patients with appropriate information in a timely manner and to be careful with the decisions one makes, as this will have an impact on the patient. As health professionals become more immersed in their work environment, they are more likely to gain a better and more comprehensive understanding of their own identity in their respective interprofessional team. It is important to be an active member of the team by actively collaborating with others and listening to constructive criticism. These are useful qualities that are not only beneficial to the members themselves, but to the entire team and the patient. The awareness and pursuit of reducing patient redundant care is important for patient safety, but also improving the quality of care. As mentioned in previous slides, interprofessional collaboration is key to managing and transferring care of a patient. Not only does it avoid duplication of services and allow for faster diagnosis and delivery of care, but it also enhances professional knowledge and the sharing of information. One reason our system depends on this collaborative approach is because professional specialization is on the rise. This is due to the expansion of knowledge and skills required to manage many chronic and complex health conditions that exist in today's world. In other words, one patient may have multiple care providers for one or many health conditions. For example, a diabetic patient may be cared for by a family doctor, foot care nurse, ophthalmologist, dietitian, and nephrologist. Each of these professions provide a special type of quality care. Oftentimes, it is one professional who would refer the patient to the other. This is why role clarification is so important in a collaborative healthcare setting. Identified as one of 6 competency domains in the Canadian Interprofessional Competency Framework, role clarification is more than simply task shifting and delegation. It is a true understanding and appreciation of the roles and responsibilities of both one's own profession and the profession of others. All of this is in an effort to collaboratively create and adapt care plans to meet the diverse needs of patients. Although referring to a patient to another professional sounds simple, it's actually not. Interprofessional collaboration is a skill that must be learned. So the question is, how? The World Health Organization states that interprofessional education, or IPE, occurs when students from 2 or more professions learn about, from, and with each other to enable effective collaboration and improve health outcomes. This picture asks good questions. How can they work together if they don't learn together? In other words, to achieve a collaborative team-based environment, IPC must be taught and promoted in healthcare students. Given the advantages of IPC on quality patient care, the World Health Organization agrees. Prompted by nearly 50 years of inquiry indicating that effective IPE enables effective collaborative practice, in 2010 the WHO disseminated the Framework for Action on Interprofessional Education and Collaborative Practice in an effort to highlight both the current global status of IPE and interprofessional collaboration, and also the important next step policymakers can take within their local health system. The study found that Canada had already made recommendations for IPE to promote team-based working in the Romanow Commission, and the government of British Columbia had already passed legislation in 2008 that included a provision on interprofessional collaboration. It also highlighted the emergence of Canada's National Health Science Students Association in 2005. To date, this association remains the strongest link to Canadian health and human services students. While great strides have been made to advance IPE, there is a strong indication that IPE enhances patient outcomes. It is argued that with more studies are needed to make generalizable conclusions about IPE and its effectiveness. This is certainly an opportunity for further research in the future. This type of research is especially important because exposure to different professionals and approaches to care management have the potential to yield a more educated and informed patient, another significant reason for IPC in Canada. Patients benefit from an interprofessional approach because they have increased exposure to professionals in fields that they had not had knowledge of before. By sharing patients' healthcare information with not only their primary care physician, patients are able to receive the best care when they need it most. A study by Goldman and others looked at a small family health practice in Ontario and showed that patients were accepting to receiving regular care from not just a physician, but were open to nurse practitioners and others. The study did find that educations of patients would be key to the interprofessional approach, as many would not be aware of what other healthcare provider roles would be, as the traditional family doctor approach is what most individuals are familiar and comfortable with. Finally, the ethical principle of autonomy recognizes the right of a patient to self-determination. This is an often forgotten principle in healthcare, as traditionally, physicians have a paternalistic approach to providing care for their patients. That is, they limit their patient's autonomy by doing what is best for the patient, rather than what is considering what is important to the patient. Interprofessional collaboration helps patients have their autonomy respected by providing them increased knowledge regarding their health and allows them to make informed decisions about their care. Many studies, such as one completed by Suchman and Associates, have shown that if patients' autonomy is supported by healthcare providers, and if patients are educated about their healthcare options, the patients are more motivated to participate in their healthcare decisions and tend to make the recommended behavior change and maintain a positive healthcare status. This open communication model between all parties make everyone feel like they are being included in a thinking process regarding the decision. So our group has decided on these 3 next steps that we feel need to be embedded in Canadian healthcare culture in order for IPC to work. They include increased education of healthcare professionals starting in post-secondary regarding interprofessional collaboration. Increased education of patients also needs to happen regarding other healthcare providers and the options they have. There also needs to be the development of a standardized method of evaluation of the effectiveness of interprofessional collaboration amongst all professions. Thank you very much for taking the time to listen and read this presentation. If you have any questions, we would be happy to address them in the discussion board that the instructor has set up on Blackboard. For further information, you can always consult any of our references that we have made in this presentation. Thank you very much.